was at work and I got a frantic phone call from my wife. It's just not something I've ever heard in her voice before. And she was just sobbing uncontrollably. The lieutenant from the fire department took the phone from her. Hey, Mr. Hurd, I'm the lieutenant with the fire department, and your son didn't make it. I fell to the ground, like my legs just went out from under me. Easily the worst day of my life.
Columbus is a world-class city. We have a thriving economy with stable, good-paying jobs. We have one of the country's lowest unemployment rates, great neighborhoods, and a quality of life that is second to none. Yet, as great as our community is, some of our most vulnerable residents are being left behind. They need our help. Every year in Columbus, more than 150 babies die before their first birthday. That's enough children to fill 5 kindergarten classes. Our infant mortality rate is twice that of New York City. And African American babies in our community are 2.5 times more likely than white babies to die before they reach the age of 1. What's worse, it doesn't have to be this way. Other communities have taken successful steps to reduce infant mortality. Columbus can do the same. This video describes the toll on our community and the case for change. It's a crisis that our state and community leaders and the professionals who deal with it every day all agree must be solved.
So Will never made it to the hospital. He basically was pronounced at the scene. 12 weeks later, we got a report from the coroner's office, and it listed it as sudden, unexplained infant death. And when something like this happens, especially so unexpectedly, it just knocks you for a loop.
This is a tremendous problem. It greatly affects the community. Infant mortality is kind of looked on as a barometer of the health care and the community overall. I don't think we have a great appreciation for how important and how tragic this is. As you know, we rank in the lower part of the country as far as the infant mortality rate, and we've got a tremendous job to do. 3 to 4 babies die per week here in the city of Columbus. And oftentimes on the news we hear about homicides and things like that, and these silent deaths go unnoticed by the majority of the population. And I hope we can raise enough awareness to show how important this is. For every 1 white baby that dies, we have 2 African American babies that die. So you can see there's even a health disparity there in terms of this infant mortality. And it's tragic when you think that these potentially are lost lives and how they affect not only those families but the community as a whole.
Well, infant mortality is the true measure of the community's health. And so when you have a high infant mortality rate like we do here in Columbus, it's an indicator that something's not healthy in the community. And as a public health practitioner, I feel that there's something we have to do to address that, to reduce our numbers. Our numbers are much higher than other communities, other cities of our same size. So we need to work together to address this issue to help the public health here in Columbus. Health is really more than health care. We live in a great community with great hospital systems. So access to care is not the only issue. Sometimes there are things before a mother gets pregnant, making sure that she's healthy, making sure she has safe housing, making sure she has food, nutritious food, making sure that she lives in a safe community.
Well, where I live at now is, violence every day, gunshots every night, so you do have to worry about, my child growing up in that neighborhood and me being able to make a difference. A cousin of mine, she had lost a baby, and another cousin of mine had lost a baby while she was pregnant, and that was hard for me.
We see babies, almost weekly here. Most of those deaths are sleep-related deaths. So, what we see those, we're trying to determine a cause of death, and sometimes they're usually undetermined because there is no specific disease process that these babies are dying from. We never get used to seeing babies on our table, and that's because most baby deaths are preventable.
The reality is this happens to everyone. This happens regardless of race, regardless of economic status, regardless of where you live in the country, where you live in the world. This happens to everyone, and it really is important for people to know.
This is not just a problem for the city, this is a problem for the state, and therefore it's a priority for the state. So we've been given a great opportunity to gather our resources, refine our ideas, and move forward. First and foremost, I'm a mom. I gave birth to premature twins. This issue is important to me. Every child deserves a healthy start, and the more we can encourage healthy pregnancies and healthy first years of life, the better off our children and our communities will be.
We have the resources, expertise, and commitment to do something about it. We can do better. We must do better. And with your help, we will do better. All children in our community deserve to live healthy and happy lives. And it is up to all of us to make sure they get that chance. They are counting on us. We will not let them down.